Imagine a world where people who are terminally ill could enjoy the end of their lives at home with their families instead of laying in a hospice. Imagine being able to eat your favorite foods without throwing up. While this may all seem morbid, this is a reality for a lot of terminally ill patients. They are in pain, they cannot hold down food, and they have no energy. The current legalization of marijuana is helping terminally ill patients to live the end of their lives to the fullest. My name is Tara Repser, and I'm a college student at the University of Louisville. Today, I will talk about the current legalization of marijuana for medical purposes. Through research, I have been able to conclude that the United States government is on the right track in legalizing it. In 1970, the United States government placed marijuana on the Controlled Substances Act because they considered it to have, quote, no accepted medical use. Since then, 29 of the 50 United States and DC have legalized the medical use of marijuana. According to Dr. Susan Oki, a Harvard Medical School graduate, family doctor, and scholar, the benefits of using marijuana for medical reasons far outweigh the negative health matters associated with its use. I can conclude from this that marijuana should be and will be accepted as a method for treatment for some patients who are suffering with illnesses such as cancer, AIDS, multiple sclerosis, and eating disorders. In the same article by Susan Oki, some doctors prescribe medical marijuana to deal with chronic or neuropathic pain. Oki provides numerous examples, but one patient mentioned is Angel, who is dependent on the drug marijuana because she found it, quote, helped her control her pain and increased her appetite. The patient and her doctor believed that her health will, quote, fail extremely if she is denied the use of medical marijuana because she will not be able to bear the pain. Although the doctors in the article prescribe marijuana primarily to control pain, some have found it effective for treating muscle spasms, mood disorders, AIDS, migraines, and to increase appetite in cancer patients. Quote, when appropriately prescribed and monitored, marijuana can provide immeasurable benefits for the health and well-being of our patients. Donald Abrams, professor of clinical medicine at the University of California at San Francisco, wrote an article titled Cannabis and Painful HIV-Associated Sensory Neuropathy, a randomized trial. In the journal, he wrote, quote, objective, to determine the effect of smoked cannabis on the neuropathic pain of HIV-associated sensory neuropathy in an experimental pain model. Patients were randomly assigned to smoke either cannabis 3.56% THC or identical placebo cigarettes with the cannabis extracted 3 times daily for 5 days. In conclusion, smoked cannabis was well tolerated and effectively relieved chronic neuropathic pain from HIV-associated sensory neuropathy. The findings are comparable to oral drugs used for chronic neuropathic pain. This study highlights how medical marijuana can be extremely helpful in patients when it's prescribed and regulated. Dr. Abrams compared the findings to other oral drugs used for chronic neuropathic pain. Furthermore, in the discussion of legalizing marijuana, a useful analogy can be made to gambling. McCone and Rotter were able to conclude that the government's approval of marijuana would encourage and promote the use of marijuana. They point out that, quote, the moral debasement of state government is the phenomenon that only a few academics and preachers bemoan. The analogy made was that the legalization of gambling did not decrease the amount of illegal gambling. Instead, illegal gambling increased when gambling was made legal. One can say that this analogy could apply to recreational use of marijuana in the case that if marijuana were to be made legal for recreational purposes, illegal marijuana trafficking would only get worse. The reason why there is illegal gambling is because legal gambling is controlled, taxed, and regulated. The only way to reduce the illegal trafficking of marijuana would be, if it were to be legalized, would be to sell it untaxed and unregulated to any willing buyer. Selling marijuana without taxing it does not allow the government to make any profit. The legalization of marijuana for medical purposes will help the economy. By legalizing marijuana recreationally, how can the United States government regulate it? How can you ensure that people will not continue to sell marijuana illegally? Just the same as hydrocodone, Percocet, and other pain relievers and other muscle relaxers, the United States government can regulate it. Like these drugs are prescribed in pill form, the United States federal government's new plan is to also prescribe marijuana in pill form, not plant form. The main reason for this is to prevent children from getting into the drug. Most adults who are on muscle relaxers or other strong pain relievers keep them out of reach and out of sight of their children. Pill form marijuana will allow adults to track how much they have and how much they're using. For anyone who has used marijuana, they know sometimes it is hard to keep track of how much bud plant you have once you begin smoking it. However, with pills, you will know how many pills you have prescribed. For example, if you have prescribed marijuana pills for 10 days and after 5 days you're out of pills, you will know someone else was taking your pills. So today, I talked about the current legalization of marijuana. I talked about how medical marijuana is being legalized in all 50 states. I then discussed how it will help the economy. In closing, live your life to the fullest and legalize medicinal marijuana.